Welcome back to another explainer. So today we are tackling the absolute bedrock of medical billing and coding. We're getting into part 37, which is all about the HIPAA privacy and security rules. You know, when you're handling patient data, you aren't just processing paperwork. You are literally the front line of defense for their privacy. So let's dive right into the rules, the strict safeguards, and the massive stakes of compliance.
Here is our quick roadmap for today. First, we'll look at the rules and rule makers. Second, protecting patient privacy. Third, the do's and don'ts of daily compliance. Fourth, remote billing security rules. And finally, we'll cover the severe consequences of HIPAA breaches.
All right, let's kick things off with Section 1, the rules and rule makers, establishing authority in the healthcare space. At the federal level, you've basically got a few major heavy hitters calling the shots. The OIG, or Office of Inspector General, establishes the compliance guidelines that stop fraud dead in its tracks. Then you have CMS, which administers massive programs like Medicare, setting the standard that even commercial payers end up following. And sitting right at the top of that hierarchy is the HHS, the main government body dedicated to preserving Americans' health.
And all of this brings us to HIPAA. Passed by Congress back in 1996, it completely replaced this messy patchwork of different state laws with one strict nationwide standard. It legally mandates exactly how covered entities, like healthcare providers and insurers, absolutely must safeguard patient rights and health information.
Moving right along to Section 2, protecting patient privacy. This is really the core of confidentiality. At the center of this entire ecosystem is PHI, or personal health information. This confidential data is heavily regulated, and it doesn't matter if it's stored electronically as ePHI, printed out on physical paper, or just spoken orally in the hallway. HIPAA actually gives patients the right to find out exactly who has accessed their medical data over the last 6 years, with just a few exceptions for routine care. I want you to look at this quote straight from our source material. It says, "The fundamental principle of patient confidentiality is quite straightforward. Information should not be disclosed to those who do not need it. We call this the minimum necessary standard. Think about a crowded waiting room. The patients sitting there have absolutely zero need to know another patient's name, their date of birth, or why they're seeing the doctor, right? It's on you to ensure that information stays completely invisible to anyone who doesn't explicitly need it to do their job." Now, while privacy is a fundamental right, there are some very specific exemptions where organizations actually don't need a patient's explicit permission to share data. This includes public health emergencies, like reporting infectious illnesses to the CDC, complying with legal subpoenas, and dealing with workers' comp. It also covers third-party entities doing routine care, like billing services or clearinghouses. But, and this is a huge but, that is only allowed if a strict, legally binding business associate agreement, or BAA, is in place to guarantee they'll protect that PHI.
All right, let's get into the practical stuff with Section 3, the do's and don'ts, focusing on operational safeguards.
Daily compliance is built on 3 strict categories of safeguards. First up, administrative safeguards. This means undergoing regular staff training and treating patient data with the utmost respect. Second, we have technical safeguards. This means you need to use obscure, frequently changed passwords and store them in secure password managers. And third are physical safeguards, so keep your voice low on the phone to prevent oral leaks and wear your uniform in clinical settings to maintain a highly secure, controlled facility environment.
Conversely, here are the absolute non-negotiable don'ts. Please, do not write your passwords on a sticky note and slap it on your monitor. Do not share your login credentials with other staff members. That is a direct, massive violation of technical access controls. Don't use the same password across all your systems, and absolutely never discuss a patient's personal matters out in public areas.
Now, let's pivot to Section 4, remote billing security rules. We have to talk about the work-from-home reality. Listen, working off-site doesn't lower your HIPAA requirements, it actually raises them. Here's the strict protocol for remote billers. Step 1. Secure a completely private workspace with a strict clean desk policy, including the secure destruction of any printed records. Step 2. You have to use privacy screen shields, so your own family members can't accidentally view ePHI. Step 3. Your devices must lock automatically and route everything through secure VPN connections. And Step 4. Enable multi-factor authentication, or MFA, across the board, and update those portal passwords constantly. There is a really strong warning directly from our source text about this. Remote coding is usually just not a smart move for beginners.
When you're in an office, you have seasoned pros right there to help you grasp incredibly complex documentation language. Working completely alone without that safety net can quickly lead to serious accuracy and compliance disasters.
Which brings us to our final topic, Section 5, Consequences of HIPAA breaches. Let's talk about the price of failure. When a breach actually occurs, the provider immediately falls under the strict breach notification rule. They are legally mandated to report these unauthorized disclosures to the affected individuals and the HHS Office for Civil Rights, the OCR, within very strict timelines. From there, the penalties scale drastically based on intent. You've got unintentional breaches from sheer carelessness on one side and intentional, malicious breaches on the other. For a simple, unintentional mistake, say, just an honest accident where data was briefly exposed, the absolute minimum punishment starts at a $100 fine. But keep in mind, if that minor infraction keeps happening, it's going to quickly jump up into the thousands.
Now, watch how fast the stakes escalate. If an accidental infraction stems from pure carelessness and the provider realizes it but is guilty of a negligent failure to actually fix the situation, those fines will aggressively snowball. In cases like that, the penalties can quickly exceed $1 million. It's literally $1 million mistake.
And then there's the absolute worst-case scenario, intentional malicious breaches. If a staff member intentionally discloses patient information to profit financially or just to cause harm, they aren't just facing those hefty fines anymore. They're looking at severe criminal sanctions, including up to 10 years in federal prison. The law takes this incredibly seriously, and for good reason. So should you. So I want to leave you with this final thought. When you look at a computer screen full of patient data, are you just seeing numbers and codes, or are you seeing a human life that's been entrusted to your care? As a medical biller and coder, you literally hold the keys to some of the most sensitive information on Earth. Guard it fiercely. Thank you so much for joining me for this explainer. Please like, share, and subscribe to Decode Healthcare with Harshal.